Blow really hard.
People in this community want to see research that really makes a difference.
Big one in.
We've been able to detect viruses that we weren't previously able to detect.
Big breath. Blow.
I think we're lucky. We're very lucky in the scheme of things. We're not in a third world country and that we have these facilities on hand.
This is how childhood should be: happy, healthy and full of promise. Most Western Australian kids are doing well, but local health researchers say we can always improve.
The big challenges that we've got now for kids' health in WA are about the diseases of the future.
The Telethon Institute for Child Health Research has been studying children's health in this state for more than 2 decades, forging an international reputation as one of the leading child health research institutes in the world. Now it's starting over.
We've built on an amazing reputation, particularly around Fiona Stanley, and we've been thinking we want to make sure we're here for another 2, 3, 4 decades at least into the future.
In a bold move, the Institute has rebranded to become the Telethon Kids Institute.
It's not just about changing name, changing logo. It's about really the Institute taking a look at where it is after 24 years, looking at what the community needs, what the challenges and opportunities are for research, and then responding to that.
Professor Jonathan Karapetas heads the Telethon Kids Institute and says the health problems facing today's young people are problematic.
So we've got much more complex diseases, lifestyle diseases, mental health issues that will require much more complex solutions.
The Institute's identified 5 issues of major concern.
The problems for Australian kids are a combination of what has been there forever, things like infectious diseases, and they're not going away. But there's a whole lot of new things that have emerged.
Like understanding the burden of obesity.
Obesity is the biggest public health threat in this country right now. For the first time in the history of this planet, today's kids are predicted to have a shorter life expectancy than their parents.
1 in 4 Australian children is overweight or obese.
The things that put them on that trajectory to obesity start in the womb, they start in those first few years of life. So we've got a number of studies right now and studies planned in the future to look at interventions that can happen during pregnancy, during those early years.
Also of major concern, mental health, an issue Professor Karapetas says has been largely neglected.
We know that we need to work with families, with schools, to better understand not only what's causing these problems, but also to better understand how to equip those kids to deal with those stresses.
The list also includes infectious diseases. Back in the 80s, researchers thought they'd beaten them, but they remain a concern, as do childhood cancers.
Only a couple of decades ago, the most common cancer in kids was a guaranteed death sentence. Now, 80 to 90% of kids with that particular type of leukemia not only survive, they're cured. That's an amazing success story because of research.
The focus now is on finding better treatments.
Cancer treatments are poisons. They poison the cancer, but they can also poison people. So we need to look for better ways to protect kids from the side effects of those treatments.
Another success story, asthma and allergies. Still a major concern, but the Institute is making headway.
We now know that viruses are the major trigger for asthma.
Respiratory paediatrician Professor Stephen Stick is research strategy leader at the Telethon Kids Institute. He says they better understand why some kids are more susceptible to developing asthma than others.
The majority of children that come to A&E are actually there with their asthma because they've got a virus infection, and most commonly the cold virus.
How recent is this discovery then?
Probably within the last 3 years.
And what were the common triggers prior to?
It was always thought to be that allergies were the major trigger for asthma. I think we know that children with allergies have a different immune system and probably a different immune response to viruses.
5-year-old Ethan Andrich was diagnosed with asthma at the age of 2. Mum Kirsten's hoping he'll grow out of it, but is taking part in research to learn more about the risks.
We could see what triggers he had, so if we can minimise those triggers and therefore lessen the chances of him having an asthma attack in the future.
Asthma and allergies, obesity, mental health, infectious diseases, cancer. 5 child health problems the Telethon Kids Institute is working hard to better diagnose, treat and ultimately cure.
We're here as an institute for improving the health of kids of Western Australia and of the world. The issues we're dealing with are not going away, and neither are we.